So yes, my dear doctor, the approach that you need to start from the food end, my dear. I just will show, and so that you can think about it. And next, later on, that I'll show actually how you need to examine in the real exams. But I just show you to the peoples, just to having the approach, my dear, as we learned. So the symmetry, as you said. So let's see the symmetry. So you need to see the symmetry from here. And tell him, just, can you turn your head on the left side, sir, for me? Yes. Now take a deep breath in and out all the way through your mouth. And you need to be very vigilant once again. Once again. To see the right and left side of the chest, whether this is moved symmetrically or not. So the 2 times is enough. If you found the symmetrically chest expansion, yes, the diagnosis is the COPD, bronchiectasis and pulmonary fibrosis. And then you need to keep in your mind that you need to come back here, just, yes, to look at like this, to this level, to see the AP diameter. No need to measure in the real exam, just to have a good look whether is AP diameter is increased or not. If it is increased, then the diagnosis COPD and bronchiectasis. If it is not increased, pulmonary fibrosis. If it is increased, the diagnosis bronchiectasis and pulmonary fibrosis, then you need to take the stethoscope, just put the stethoscope onto the back to get the crackles. If you found the crackles, diagnosis bronchiectasis. If you found crackles, no crackles, only the COPD is the diagnosis. So the similar way that you found that from here, that you, whenever he takes the breath in and out, so turn your head on the left side, take a deep breath in and out. Now say example that you found that the left chest moves less than that of the right, means you found the left side having less movement. So you can think about definitely the left side, there may be the scar on the back. So you need to tell him, just, can you just sit forward for me, sir? And have a look onto the back. If you're looking onto the back and if you found a scar like this, so it's a lobectomy and pneumonectomy. So asymmetry is scar, lobectomy and pneumonectomy, then you need to put the trachea, hands to diagnose whether it is pneumonectomy and lobectomy. If you found the asymmetry, then you come back, there is no scar here. So diagnose the Darlon percussion, diagnose the pleural effusion, pleural thickening, consolidation, collapse, and cancer. The most common, as I said, the pleural effusion is the diagnosis. The single point they need to remember. So asymmetry, no scar. Darlon percussion, the single diagnosis, pleural effusion. Very rarely pleural thickening is not given, I'm saying. Consolidation not given. Collapse, yes, the trachea should be shifted. And cancer cases, very rarely the trachea is not shifted. So trachea shifted, only the collapse. Trachea shifted, yes, if it is a massive pleural effusion. So trachea is not shifted. So once again, asymmetry, no scar, Darlon percussion. Yes, the trachea will give you the answer, trachea central. Pleural effusion, massive pleural effusion, trachea shifted towards opposite side. But trachea shifted towards that left side, diagnosis collapse. So this is the simplest approach, my dear, that you need to apply whenever you are doing these examinations. Now lie back for me, sir. So now, dear doctor, listen very carefully. What I'm going to do, I'd like to show how to examine, means the examination scales. How to examine in your real exams.